Their argument was that it was kept in the control cupboard, and everything that's in the control cupboard should be in the control book. Different inspector come in and do meds pharmacy, the check everything, goes, why have you got water in here? Like, and then started, they're going to go through all your books. You're going to, and I said, listen, I said, your inspector last time I came in has advised this, and I've got it in writing. So if you want us to stop doing that, you need to put that in writing to me. I said, and I will stop it.
Hello and welcome to the Health Automated podcast. I'm one of your co-hosts, Mark Tops. Delighted to be joined today by my other fellow co-host, Jack. How are you, Jack?
I'm good, Mark. Thank you. How are you?
Yeah, not too bad. Thank you. Not too bad. Been a busy week, but can't complain.
Yeah, it's back to the normal grind after half term and everything and getting out of the way.
I know. Although half term in a couple of weeks, bank holiday Monday, and we'll be thrown right back out of sync, unfortunately. But
I genuinely don't remember this much school holiday when I was a kid.
No, I definitely don't.
I remember it as a parent, though.
Delighted today to be joined by Nicola. Hello, Nicola. How are you?
I'm fine, thank you. How are you? Thanks for having me.
No, thank you for joining us. Nicola, did you just want to introduce yourself? Then I'll kind of introduce the topic for today's podcast.
Yeah, of course. So my name is Nicola Holmes. I'm director of Every Step Consultancy. I'm based in Blackpool. So my role is generally working with clients and people who may be having inadequate or requires improvement rating, and I specialise in turnaround management for care services. I'm also a nominated person for a new service recently started called Standby Healthcare, which is offering supported living and complex care packages.
Thank you very much. Congratulations on your new NI.
Thank you very much.
So, consultancy is what we're going to talk about today. And I think when I was reflecting back on the conversation, I kind of was thinking about kind of providers and how much they would have got involved in some kind of, quality role, either internally or externally. And I really think that the new CQC framework has kind of spurred people to think about what they're doing, the data they're capturing, that quality side. And I think there's more emphasis on outside support. We know the CQC are obviously just there to check, but they don't offer that kind of supportive role. And I think more and more providers are going to find that support and that input to improve their services and continuously develop. What have you found kind of since the framework, Nicola? Has there been a difference, or is that just my perception?
I think there was a panic at the beginning where the changes are being made, and I think where people have the time, it depends on the type of service you have as well. So if you're a small organisation, just maybe one home, one manager and one owner, they kind of just carried on maybe, and then sort of the bigger organisations where they've had more finances involved, they've had someone go and look and explore, and then have someone else come in and check it out, see actually what's going on. So they've noted maybe that somebody in their areas maybe been inspecting a new framework and they've got inadequate or requires improvement, then all of a sudden everybody's like, we need to look, we don't want to be in that situation. This is what we're going to be. We need to do something about it. So and there's been more questions. I don't know if you're across in the Facebook forums or the different forums for managers, and people are asking a lot more questions, and people have been a bit more open as well about the experience of the inspections and what they've looked at. As things are going along. But I think overall, everyone has been inspected under the new framework, and everything that they're looking at, everyone's having a good look at what they're doing. So it's not more tick box exercises. So I could talk about auditing forever, but one of the biggest things, we go into a service where you've got an audit, is like, yes, that's in place. No, that's not in place. Yes, that's in place. And what we're looking for is the evidence of why that yes is there, evidence why that no is there. And it's that education piece where some inspectors or services may have had, I call them old school inspectors, or maybe they've got the new paperwork changed, but the way they do their inspections is exactly the same. And then you retire, and then you get maybe a new inspector who's been trained fully in the new framework and knows everything, and has actually looked at everything. And these little homes or services sometimes are then in for this big, massive shock because, well, no one's mentioned my mental capacity assessments weren't great. No one's mentioned my audits weren't great. These are the same ones we've had for the last 7-8 years, and no one's told us to change them. And all of a sudden they're in, got a warning notice, there's all this stuff going on, and they're completely drowning. And so, in all honesty, in answer to the question, it varies from location, and it varies on funding and the finances the provider actually have got.
No, absolutely. Jack, anything from you at all? Anything you've seen kind of from a health automated point of view?
So we're starting to see on the tech side a lot more people moving towards automated levels of compliance, because as there's been, as Nicola said, changes in frameworks, and especially with regulation continuously growing and adapting with the sector, there seems to be a lot more focus on making sure your ducks are in a row at an organisational level, should we say, especially with the compliance. So we see a lot of providers are now moving towards more digital ways of working to try and, should we say, compile all of that data into one sort of area to make it more logical for them to present this in the ways they need. Obviously, look at the old PIR and how much data that took and how long that would take people to submit, and having the new digital systems to bring this together does help. But from an organisational point of view, there was a lot of flap from some of our customers when things were coming into place, and there was a lot of ambiguity. I definitely agree with what Nicola said. Going back to my previous experience of working in social care directly in should we say, service user facing roles, there was no real uniformity between inspectors, and a lot of it was more based around their interpretations of how they would look at things, and you could get very contrasting and contradicting feedback, especially if one's given some points and then you have a re-inspection around an area, then someone else can come in and turn it back upside down and tell you how it should have been previously. And it does cause, in my opinion, a lot of frustration for the managers and business owners.
Before I went to be moved over to consultancy, I was a manager for a care home. I moved over to this care home from a sister home. The home was rated inadequate. It's in special measures, warning notice and everything in. And there is somebody in our area, and that I now know as a consultant, if that person goes in, there's some information, background information that CQC are aware of. Because when this person goes in, and basically, I wasn't part of that inspection when they came in the first time for the inadequate rating. And one of the things was written on there was that the water for end of life medication, you obviously have supply of water, you have supply of medication, and they wanted that written in the control book. And they said it was unsafe for it not to be, but it was like, it's not a controlled drug. But their argument was that it was kept in the control cupboard, and everything that's in the control cupboard should be in the control book, which makes sense. But at the same time, it was a little bit picky. But unbeknownst to us at the time, there was more stuff underlying, which obviously we found out later on after the management I'd taken over, and we found more issues. But at the time, so we then got inspected. So it was just be August 2020, a different inspector come in and doing med pharmacy. They checked everything, goes, why have you got water in here? And then started, they're going to go through all your books. You're going to, and I said, listen, I said, your inspector last time I came in has advised this, and I've got it in writing. So if you want us to stop doing that, you need to put that in writing to me. I said, and I will stop it. Because one of the arguments was when we were contesting the rating, or some of the parts of the rating, was this bit was unjust. Where the other medicine pharmacist didn't put that in writing to us and just left it as that. But it's a clear example of like what they wanted. So some inspectors really want a PRN care plan with all the details of the PRN and when to do it. But the PRN care plan is sort of mimicking the PRN protocol, which you've already got in place, or you may have already mentioned it in your medication care plan, but they want it more detailed. They want that, and then the interpretation of it in your area, it depends on your inspector and what their specialism is. So I favour mental capacity assessments. I love the Mental Capacity Act. I'm very passionate about it. So when I do a mock inspection, I do lead to look at mental capacity. So it takes me into the medication, takes me into the care plan, takes me at least restrictive. So it's like when I go there, it takes me in all these different directions of where I'm looking for and doing a mock inspection. But if you've got someone who's doing a mock inspection whose favourite subject is more health and safety, then even though they're covering everything, they are going to maybe focus more in the area that they're more passionate about. So, and I think the same applies to the inspectors that are coming into your service. I do think that's exactly the same thing will happen.
Yeah, absolutely.
No, absolutely.
I was going to say one thing I do know. They did try to refine this a little bit with experts by experience, didn't they? If you remember, and in some cases it went down well, some cases not so well, but there's also a big contradiction at times between CQC regulation coming in and what the required standard is, and then PAMS.
Yes.
And this is another one we get a lot of confusion about from our customer side, and it's something, speaking to many managers over the years and social care business owners, it seems to be something that just can't be contained nationally in some standardized way to make life easier.
No. And PAMS is good. I think some local authorities don't do checks and don't like. There's some local authorities I've worked with who have been really proactive, and they're coming in and doing visits to the service and they're checking how things are going sort of every 2 weeks, and they're being more of a supportive role. So they've got the PAMS, but they're coming in and saying, well, how are you getting on? Or actually, can you tweak that? And I found that a lot more, like, it builds a better relationship up with the provider and the local authority. And I found them a bit more supportive. Then you've got the other ones that just do the PAMS and then don't come back to you ever again until the next PAMS is due. And they say you're still doing all this wrong. And, or this is not what I asked for. This is what I wanted this. And then there's confusion, and CQC have been in the middle of it, and CQC, no, we don't want this, we want that. And it is, and it adds, if the home's like inadequate or requires improvement, it can add even more pressure onto a manager and the team already were swimming, trying to get out of the situation that they're already in. And you've got this conflicting information all the time. So it is really, really hard. I do like PAMS, especially, but it depends how it's used. I do like PAMS. There is some local authorities out there that are still not doing it. I still haven't got it in place. And it'd be interesting to sort of do a bit of research, actually, from my point of view. It's like, where PAMS isn't being done, what is the rating, the average rating in that local authority? Because I'm seeing if actually is a benefit to people going out. Because I think that's that oversight. But I have had PAMS have come in and maybe checked a home, rated it good, and then CQC have come out maybe 3 months later or even 8 weeks later and rated it inadequate. So again, it's perception, like we said before, it's what they see. Are they actually going around and looking at things? Because their job is to find things and to help and support the service. It's not just going, oh, yeah, oh, she's lovely, that manager, get along with her really well. You can meet someone like me who can talk to you all the time, and then you actually won't get your job done. So it's having that control. So it depends when you're going out. Just because you know them doesn't mean that, you need to check that information. I think local authorities also need to maybe quality check their PAMS inspection to see. So when that does happen, if CQC comes in afterwards and rates them inadequate, did that person have the right skills to do that PAMS inspection in the first place? Were they up to date? Were they looking in the right places? And I think they should be under the same scrutiny as well.
No, I completely agree. And I think some of it, I mean, I'm very lucky at the local authorities that I work under, and historically have always had PAMS. But a bit like with the CQC inspectors, sometimes they haven't had the experience or the relevant experience of what they're auditing, which then makes it really difficult in terms of, well, actually, here's the reasons we do it like this, and this is, under this part of the Care Act or these regulations and X, Y, Z. I think working in reablement, I find that all the time. I mean, I'm really lucky in one of my local authorities that the person that works at PAMS used to head up their reablement service for the local authority. So that one's slightly different. But the others, there is definitely a lack of awareness of what reablement is, but also from a CQC point of view. And I guess that kind of triangulates into where consultants are now coming in, because I think we've lost that kind of supportive approach, those named inspectors. So you're giving all your actions in terms of what you need to improve on, whether that's from your PAMS or your CQC inspection, or whether that's your self-audits, but then you don't really know where to turn. And I see it all the time. Oh, we need to do this. Does anybody have any ideas on those manager groups or in forums and bits and pieces? And I think then people are grappling around. And I think from a quality point of view, if you haven't got an internal quality team, actually that investment from somebody externally just double checking actually can go a long way in terms of offering that support to the registered manager and the director separately, but also in terms of that forward thinking vision of, well, this bit element might be good, but how can you then improve that to be outstanding or to showcase kind of what you're doing?
And I think it does depend on finances. I think it's really needed. When I had my interview with CQC recently, one of the things they asked me was quality assurance checks, what we was doing, how was it, and how would I ensure non-biased of the documents we're in, which I thought was actually a really good question. I did say mock inspections, obviously, and what I did say, obviously, I do have my own business. This is what I do, what I do to turnaround management, but I wouldn't actually have me. I'd have someone else in my circle, and I want someone to come in with fresh eyes, because even when I'm doing a turnaround project and I'm in there and putting the orders, I'm in the middle of it. I'm part of the team. I'm working with everybody else as well. So I do need someone else from outside to come in and do that mock inspection, because you do become blind. It's like, you imagine doing like this, but if my mum says she's going to pop round seeing my house, pop round for a cup of tea, I'm like straight up, I'm like tidying up, making sure everything's all done. So then all of a sudden all the skirty boards need doing, everything needs doing. And I need like that. And sometimes you become blind to like, that tap's not working, but you just live with it because you've always had the tap not working. So everyone just is used to it. But then when someone else goes, well, actually, if that tap's not working, how are you getting your water? Where's that coming from? And then it leads to all these other questions. So I think having someone in to come in, and even if sometimes mock inspections can be expensive, there's companies out there that just do go in and do your inspection, but just give you an action plan. There's ones out there that just go and that come out and do a full report. And your report detail can be minimal, it can be maximum. I prefer them to have if it's your first mock inspection, to go for the full report. So that way it's an education piece. Then you can see, well, if someone says, well, this wasn't in place and this impacts this regulation or this, then it's everyone who's reading it and want them to learn from it as they're reading that report. And then moving forward, to make it less expensive, you could just get the action plan or a smaller report. So there is all different formats out there. But it's being careful who you are picking. You want some references from the person who is coming out to you, and not just reference from them, maybe contact the services that have already been in and what do they think of them, and did they find it helpful? Because there's some really, really good consultants out there, and we know them quite well. And also we hear sometimes of the bad ones as well. But it's the experience that you want, what you particularly want, what you're looking for. But having that, if you're a small 20-bedded home, paying for that consultancy to come in and do that mock inspection can be expensive, especially if the other increases that we've got currently right now. If they've got a mortgage on the place, the interest rates, and it's 20 people, it's that struggle. It'd be good to see if you are on your own, and there's another home nearby who's also on their own, a bit of team effort of working for each other, or maybe one person going in doing a medication audit for you, or swapping it over and things like that, and sort of learning, and then going to your local authority forums and in the community and stuff. So there's, like you mentioned, Skills for Care, there's all these different networks where people could go in and learn that information if they can. But again, it's time restricted, and it's also expenses, money. It always comes down to funding most of the time.
No, absolutely. Jack, I'm going to bring you in, and I love that idea there, Nicola, around actually can you network in with somebody that's down the road and utilise the resources within your team. And as you were saying that, I was thinking about the amount of data that a lot of providers will have already to be able to self-audit, but they might not, which is kind of, Jack, how can providers kind of utilise data within their system? So thinking about somebody that's using, perhaps they're using Health Automated, how can they make sure they're getting the most out of that system?
So it's a very good question. There's a few verticals that go into it, and I'm just going to quickly skirt back to what Nicola was saying. And rightly so, it's good. I agree that having an external sort of quality management system in some capacity is great, because there's always going to be blind spots within an organisation. And as soon as you start working directly inside that organisation, you become part of that siloed working. And obviously having an external set of eyes is always a great thing if the budgets allow. But then I'm going to now move on to what Mark was saying, and then this is where some of the budget constraints come into that sort of two-pronged, shall we say, answer to the question, because it's a bit of a chicken and egg. Providers will say we don't have the money to pay for external quality audits and so forth, but then they'll spend a lot on staff hours and time and resources internally trying to achieve a goal that they're not sussing correctly as well. Okay, so businesses have to have a realistic outlook, and this is where that siloed working comes in, because when you're involved in a silo and you're trying to manage things like cash flow, balancing on what's going on, you have to take a short, sharp reality check and look at it as an investment, in my opinion. It's an investment in trying to make your business better. The same as you would sort of pay, shall we say, someone to help you with your cyber essentials, in that way. We can't profess to know everything in every area, although we may have good expertise, but there will always be blind spots. And that's where the beauties of individuals like yourselves, Nicola, that come into play, people that can look at it and take that holistic approach. So I would say having a good external resource or resources with good quality compliance systems and digital tools helps with this, because you'll probably find as an independent, you're asking your customers for a lot of the data to try and formulate what's going in, show us your reports, show us your compliance tools, and then a lot of the time they'll have to go and get that information. So they indirectly put off the task because they know psychologically it's going to be a cumbersome process. And we've all probably been known for delaying that, where something we probably could have in about 10-15 minutes, we're just like, oh, but then I've got to check it here, I've got to update that, and before I send it off I've got to do X, Y, Z, and these become the psychological roadblocks to effective systems and quality assurance for a lot of individuals. I'm not an admin person. My team know that, unfortunately. For that, I do apologise for those ones listening. But it's a necessary evil. And having some of these modern technological solutions, for instance, within architecture, it automates a lot of the compliance for you. It generates reports for you. It has anomaly detection. So it can give you a good baseline of what's going on at any point within the business, and it can alert you to significant changes. That's a key tool that managers didn't have 10 years ago, where they would manually have to go through and reconcile that data. And I always use the classic examples here of, especially on a community-based service. Conventionally, you used to have a care coordinator or a team leader, someone who goes around once a month to all of the individuals' homes, collecting all the MAR charts, all the records. And by the time they've done all of that, you've had the day's wage to travel, then you've got to bring it back into the office. And it used to be about a week's worth of admin time internally in an office environment of undisturbed for multiple people to try and get that checked, reconciled on to whatever system they had to start the process again. And where it was a task that relied on a lot of individuals, there's always chances that there could be weaknesses in that chain, should we say. Like someone could go off sick, which means that part, for instance, the medications officer's off sick, so that compliance tool hasn't been actioned, and that audit's not completed, so we missed that, and then we get penalised for that 6 months down the line because we had a missed month, and these are the things that happen with manual ways of working. And digital systems should be used. CQC, as part of the regulation, do encourage, to some degree, people to use innovative solutions to try and enhance their ways of working. We have to be realistic. No one nowadays uses an abacus to count. We use digital systems. I've lost the ability to do long division. I don't ever think I'll learn the ability to do long division. but if I need to work something out, I've got 4 devices around me that can calculate it within seconds. So we have to look and be real with the times. And I've said this through a lot of the podcasts. We can't expect to move forward if we use look back approaches and ways of working, knowing that we're recruiting people who are using tech in schools and education settings now, and it's a main staple throughout their life. To suddenly go back to paper ways of working and very disjointed tools, is a very, very look back approach and difficult way to work. And you'll tend to find them organisations that don't try and move and make life easier for their workforce don't have as greater retention rates as those that do implement solutions that make it easy for their workforce, because it's all about work-life balance. Everyone's busy. No one wants to be sitting there till 2 o'clock in the morning formulating spreadsheets to send them off, and that's what the reality of it is.
No,
No,
you're
it
right.
really is. Nicola, in terms of that forward thinking, and then going to go against what Jack just said, but looking back, where has consultancy come in terms of that digital age? How has that evolved consultancy for you now, having all that data and access to
So,
detail?
so because my background is turnaround management, I'm going into sort of maybe services who maybe don't have the technology, and most of the time they don't. And you'd be like surprised, like there's some. I'm not sure if I'm allowed to, but there's a big organisation that owns a lot of nursing homes over the UK. They're still on paper care plans. Like there's a lot of like, and you'd be surprised by some of the big names out there are still on paper, considering like where we are. But for me, if they've got the care plans, there's certain electronic care planning systems that I go on and I breathe a sigh of relief when they've got them, because it's I can pull the data off them for like falls, accidents, and obviously it depends what package they've got, and it makes life so much easier when I'm trying to put it together. But most of the people that I go to are still on. I've not actually worked with a service as yet. I've had plenty of demos of services that do electronic auditing, but I've not come across one service currently that I'm working with. If they did, it would make life a lot easier for me. There's been manual digital where they've used spreadsheets, like you said, Jack, where they're sticking the information in. But then when I compare it to what's actually in the care plan, or the care data off the care software, it's not there. And sometimes some organisations, sometimes the training for getting your software for your care planning is expensive. And when some people go for the minimal package, so then when a consultant comes in, I'm like, well, actually, you can just print this off here, and it tells you the patterns of the days it falls. It'll tell you like, room 3 is fallen over 17 times, and it's always at like 5 o'clock in the morning. As I can add into a care plan now and add in a planned care check that someone goes to at 4:30, ask if she needs to go to the toilet, the supported to put that full. So people, and they don't know how to utilize it. So sometimes you've got this in, and but maybe the provider didn't pay for the extra training, or the training wasn't there. The system's evolved, or they got a really, they bought it a few years ago. There's different managers, different staffing team, and no one's actually gone through the user guide or gone into the forum bits, because most softwares do have a platform where they talk about the new things or they're coming soon, and not watch the videos, and they're like, oh, I didn't know that was there. So it's sort of making sure that the technology they have got is also they are using it, because some people are just not using it to potential. And you've got to understand that your inspectors and people like myself who are coming in to help, or to inspect your service or support your service, we know how to find it. So if you say to me, oh yeah, I've done the accident incident analysis, and maybe you haven't done it in detail, or you don't want me to find something, your electronic care planning system is just going to tell me where to look, so I'm going to be able to pull that data off. So it's important that you know your system as well as the person who's coming in looking at it as well, because the technology is really, really good at making life so much easier for people and pulling things off. And like your care planning. So like, for instance, if a senior was doing a care plan for the first time, I've made this care plan, can I check? You're not getting off, you can go, fabulous, I'll bring it on my screen now. And you just look at the screen, you're like, oh, actually, can we improve on this bit, or maybe add a little bit more on that? They can go off and do it, where previously they type it all up, they printed it off, they brought it to you, you'd get your pen, mark it up. So that's like this stuff, it's so much easier now. It is so much easier, and there is, that means you've got more time on the floor, working with your residents, and that's where you want to be. So yeah, I think it is a good thing, the technology, and it is exciting, but just because you've got it in doesn't mean you don't stop learning. You have to keep making sure that when your new generation of people coming in and using that system, that people are made aware and they are keeping on top of it, and that's really, really important, because I see that quite a lot. That they're not utilising the tools that they've got in, which is sad, really, because it would make, if they learn how to use it properly, it's doing your accidents or incident analysis at the end of the month. Sometimes if you've got a big service, that's a big piece of work you can do, but some softwares will just tell you straight away what the answers are.
You're right. You get a lot of what we call bandwagon buy-in. So it's, they're a similar type of company to us, and they're buying that in, so we're going to buy it in as well, or I've heard this tool. And they don't do a lot of research about what it's actually for. And when it comes to digital systems, there's no one solution that fits every single business, and it should be assessed on a business case, if you will. What do we actually need to get out of it and achieve? But it's also got to be balanced with usability, hasn't it? The workforce have got to be able to pick it up, run with it pretty quickly. It can't be cumbersome. And it's making sure you keep up to date. It's a live data set. So realistically, if they're keeping them up to date, they should function well, as we're saying. And this is one of the things that I take away that you said, where, for instance, something's not marrying up in one document compared to another. And this is where digital systems are great, because once people are upskilled on them, they can use them correctly. They don't have to triplicate tasks. So actually, they become more efficient in the long run, because that's the thing that will catch someone out usually on an inspection. They'll update everything, but there'll be one document that they've forgotten because, they've been under pressure. Well, that one says something completely different to this one. So, and then it makes it look like they've not done something properly. And this is where the correct systems will take away that doubt. I mean, I know we're talking about social care, but regulatory pressures, especially within differences, can create a lot of problems, not just for the business but for the individual. I mean, look at the Ofsted situation not too long ago with the head teacher, with all of the miscommunications and everything that went into that. And that just goes to show the personal impact as well, that all of these processes and the disjointed ways of working can have on an individual as well. And that's what we have to consider. So having streamlined ways of working to try and make that as least stressful as possible, but making sure we can get some work-life balance back and do things properly is the key. I'd love to hear anyone who's found that solution. Get in touch.
It could be out there. I think when I first go into a service, and obviously they've just been inspected by the CQC have just called they've rated them inadequate. And then I'm in, and then my job then is to find I don't want any surprises, I want to complete the audits, but I'm also looking. So when I pull that sort of like, I always think of it as like one of the colleagues last time I actually worked with, which was a manager on the service, said to me, I used to always think you were really random, but someone will come in, ask a question, and then all of a sudden you're up here, and I'm like, how did she get from that question to up there? And you're like, well, the induction's not been covered because they should have known that. Where's the policy for this? And all of a sudden we had like another section, a load of work that we needed to get done just by somebody asking a question, and they're like, well, they should know that. Why was that not covered? They've been here like 3 years. They should know that. And she goes, I always thought you were completely random. But now I get it. I get, like, if they're asking that question, but they've done that training and they've done this, but why don't they know that? What should I put something in place? You need to check that the rest of the staff and see that. And it's that sort of way of thinking. But when I initially go into a service and the personal pressures, they've got through inadequate. I'm mostly described as Nanny McPhee. I've been called Nanny McPhee twice now.
Is that a compliment?
I don't know. I'll figure it out. I don't know. But when I initially go in, because they are then finding more problems and they feel like I'm being really negative, but my job is to get everything onto that action plan, pull everything together. And if they had electronic care planning, like electronic auditing system, or like you said, technology system, and I could input the audits, because the time it takes sometimes to then you complete the audit, then I have to go back and then add it all onto the action plan. Then we need progress updates, because not only now they've got local authority and CQC want that action plan weekly or bi-weekly. And we then need to do progress notes and everything to see where we're up to, what we're chasing. And sometimes on that action plan, you can have like 160 things on there, because I personally break down the action, because one action could be 25 actions or 3 big actions, which are a big length of work. And I tell them to break it down, because when you start seeing the greens, well, that's been completed, now we're moved on to stage 2. So, when you see all red at the beginning, but when that risk starts reducing and you start going to yellow, you start to go to green, but they're looking at it has that positive impact on that person as well. So I think it's really important sometimes to break down the action if it's multiple, and it is hard. And then I have to explain, like, I'm not here to judge you, I'm not here to cause more problems. My job is I want to find everything, put everything onto this action plan, and then we can be really clear who's doing what, how we're going to do it, and we'll work together as a team. And there is occasions, or every occasion is human behaviour, the same pattern follows. And some people get a bit upset, but then at the end, when I say, look, I'm working with you, I'm not going to leave you alone, but we do have to have these conversations. You've had that training for this, but this has not happened. Can you explain to me why that's happened? Let's work together. What do I need to do to make sure this doesn't happen again? And at the end outcome, it works. So, like, I'm lucky, touch wood, my track record for turnaround management currently is 100%. So what I do does actually work, but it does take time, and I need to have the team with me. So most recently, I took we had someone down Southway, and I had a group of homes, and there were two homes both rated exactly the same, and one manager come in, did everything that I said, but went above and beyond. She went from inadequate to good. The other home, well, see, it was a bit more difficult, did what I asked to do, and that went from inadequate to requires improvement. So it just like going the extra mile. When people working with us, I can move you up, but you could actually go further if you know, and then get that initiative and moving. But I'd love a digital system for auditing for consultants, because that'd be ideal for me. If it just automatically generated my action plan, it would save so much time. It'll make my life 100 times easier if that was in place, and everyone else to continue it after I'm gone.
Jack, is that a business venture for you?
Or let's have a chat offline, shall we?
Yeah, I think we should.
No, that sounds really, really good. But I think we've left it on a really good high note there, because we're right at the end of where the recording comes to, and I think today's given a lot of food for thought. I mean, my takeaway is definitely using individuals such as yourselves, Nicola, with a wealth of experience, with that outside looking in approach to the business, is a very fundamental tool that businesses should have within their arsenal. You know, they should not be scared to face external critique and try and improve their ways of working. I mean, I know a lot of it is transitional management as well, for change with the workforce, different ways of working. And I take my hat off to you. You know, it takes a lot to go into businesses and go, look, this is where you're going wrong. I'm here to help you, knowing that when you walk in, you're not going to be popular immediately, but by the end, you're going to be everyone's best friend, right?
You do. You've got to have the direct conversations, and you've got to have, you've got to have thick skin. You can't walk into here to be everyone, to be your friend. You can't. You've got a job to do. They've got a job to do. I'm chatty. I'll talk, but the conversations do need to take place, because when I immerse myself into a service, I become part of their team. It's not me. I work, I'm going in there to help them. Although that is my role, I see myself as part of my, and even my language changes I would like my staff team to be able to do this. I would like, and until the time goes when I have to leave, I do feel like I'm part of their team and part of their management team, and it's a nice experience. The beginning, it is hard, and it doesn't matter how many times I think, I do it, the same reactions the same. I'll tell you some stories off camera, but I can't tell you what the things that have happened to me. But they do get through, and it's hard. If you've worked in a service and for 15 years and you've always been told you've done really good at your job and everything's done really well, then you've just got this CQC have told you you're not, then the local authority told you not, and then you've got me coming in going, well, we need to improve. It's upsetting. It will be upsetting, and sometimes we need to look at, why did they feel that way? Well, getting a consultant in, like you said, if we can get a mock inspection at least once a year, just to see where you're at. We'll do your research on your experience of your inspector. So, is it supported living? Is it is it nursing home, care home? We'll look at the service and what the experience of that person coming in has, so they are looking at everything for you.
How about you, Mark?
I think for me, just listening to you there, Nicola, I was just thinking to myself, actually, we need to not see consultants as somebody that's coming in to fix a problem for you, but that forward thinking and that development. But also, you touched on something earlier around that support for the registered manager. I've been in manager positions before where you are literally, you feel like you're running up a hill, and when you get to the top, you breathe that sigh of relief and you fall right back down and you start all over again.
Yeah.
But actually having a consultant that you could pick up the phone and be like, I'm working through this. Is there any advice? This isn't working. What would you do? Just as a networking tool as well. But I do think if there's anybody listening that hasn't had a PAMS inspection, you should definitely contact your local authority, especially if you haven't had a CQC one recently, or obviously contact Nicola and she can come out and do a mock inspection for you. But yeah, I think from a mental health wellbeing point of view, a forward-thinking kind of proactive approach for a service. But I also think it reassures the CQC that you've got somebody external in supporting you with identifying where there's risks or challenges and what you're doing about them. I think actually it allows you to demonstrate the actions taken and the lessons learned.
Yeah, and that's what it is. It's all about learning, and we don't know everything. And we're working with humans, and this is the saying I always say. So we're working with humans, supporting humans who are all individual. Our staff and teams are all individual. We're individual. As I said, some mistakes are going to happen, and it's only this like they've happened. Okay, what can we do about it? But how to prevent this from happening? It's something's always going to happen. You're never going to get 100% on an audit. You never are, and you don't want to. You don't want to because you're not learning, and the audit's not working if you're getting 100%. That's my motto. But yeah, and be open. There's plenty there. There's plenty of people out there to support them, though.
Well, saying there's plenty of people out there to support everyone, Nicola, how do people find you? Tell us your website and how people can get in touch with you off the back of this podcast.
So you can find me on my website. It's everystepcare.com. I'm also on LinkedIn. It's Nicola Holmes. Facebook as Every Step Consultancy.
Brilliant.
So you can find me there.
Well, brilliant. Thank you very much, Nicola. I really appreciate you joining Mark and I today.
I think we lost Nicola just at the right time, right at the end. But very lucky it was there, not in the middle.
Right or wrong time, no matter what way you look at it. But no, it's been a pleasure once again, Mark. Thank you for another lovely podcast. And I think a lot of our listeners have got some key takeaways today. We'll share some resources.
Bit outside of technology, but
when it works, it's great. When it doesn't work,
so sorry.
You don't have to apologise.
No worries. And we'll share some of your social links and everything in the posts as they go out. So make sure you're listening to the next podcast. And thank you very much, everyone. Till next time, all the best.
See you later.
Bye.